Good morning and welcome to our Facebook page live. Today we'll be talking about post-radical prostatectomy, that's for prostate cancer, sexual and urinary rehabilitation. My name is Robert Valenzuela. I am the Director of Penile Prosthesis Surgery at the Mount Sinai School of Medicine and Department of Urology. So my specialty is rehabilitation after prostate surgery. Now, prostate cancer is one of the most common cancers, male cancers in the world. And we know that a lot of these men choose to have surgical intervention. In the past, most of the surgery used to take place either open surgery, and now most of the surgery is robotic surgery. But that comes with a price. That means after the surgery, there are going to be consequences that need to be taken care of, and they will need to have some level of rehabilitation. So I like to compare this to like a knee surgery. After you get a knee surgery, what do you have to do? You have to do rehab, right? Well, after a prostatectomy, because of the anatomy and what we're working with, you need to have some level of rehabilitation. And what kind of rehabilitation? Well, you need penile rehabilitation. That sounds kind of funny, having rehabilitation for your penis. But that is necessary in order to regain your normal function, in order to regain normal sexual function and normal urinary function. So prostate cancer, it occurs in large number of men, and the reality is that after the surgery, let's say about 90% of men are going to experience some level of urinary incontinence, and that urinary incontinence is very temporary. That means that within a couple of weeks that the valve will shut off, the muscles will regain their strength, and you'll be able to urinate without any problems, just like the way you used to before. But in a certain number of patients, right now we're talking about between 5 to 10% of men, after the surgery, they develop what's called urinary incontinence. Now, urinary incontinence is the loss of urine without conscious effort. So as the bladder fills, you begin to have small leakage of urine, require you to use pads. There are a series of procedures that we do and a series of treatment modalities that we do that we institute immediately after surgery in order to prevent this from happening and in order to take care of the problem. In the long term, those patients that do not recover, there are surgical options to take care of these issues. And we'll talk a little bit more about that in a minute. Now, the other problem is sexual dysfunction. We know that with any kind of intervention in the prostate or in the pelvic area can oftentimes lead to some sexual dysfunction. This is no exception. I'm sure you guys have heard that after a radical prostate, some of the patients develop erectile dysfunction and they're not able to recover their sexual function. Well, in fact, after removing the prostate, about 20 to 30% of men do develop long-term erectile dysfunction, but most men who are normal, have normal sexual function prior to the surgery, at about 3 to 6 months do regain their sexual function, albeit that with some assistance. So we're going to talk about that in a little bit as well. So before the surgery, there are things that we do for our patients. We like to have a team approach in order to manage these patients, which means is we like to bring in the patients, we like to have them talk to the specialist, myself or one of our other doctors like Dr. Grafstein or Dr. Kaplan, to talk about what they can do pre-op before the surgery in order to maximize their benefits after the surgery or their recovery. So once that phase of the program is done, where we talk about taking medications, doing exercises in order to maximize or improve the urinary incontinence post-op, then after the surgery, we usually see our patients at about 2 weeks. So after the surgery, you're going to need a catheter. That catheter is to help the connection between the bladder and the urethra reestablish. Once that is done, within 5 to 7 days, that catheter is taken out. Immediately after that, we begin to start our patients on medication in order to help them regain their sexual function. So what I like to compare the surgery is like a stroke. Think of the nerves of the penis being affected, therefore the penis is not responding normally. So if you don't exercise, if you don't do rehab, just like with the knee will get stuck with the erection, the penis, the same thing will happen to the penis. You lose length, you lose function if you don't exercise it. So how do we do that? We put our patients on medication. These are medications that stimulate the circulation of the penis and help it engorge independent of sexual activity, because most of the times you're not going to be sexually active right after surgery. We like to start this very soon after the surgery. We don't like to wait several months or anything like that, because that every day or every month that you wait, You lose length, you lose function, and makes it a lot more harder for them to recover. Once they start this medication, usually we bring our patients back at about 2 to 3 months. And at 3 months, we expect you to have regained some sexual function or to resume sexual function. For those guys that have not regained their sexual function, there are other things that we do. There's something called a vacuum device. This is a device that helps stretch the penis, also bring blood into the penis and help maintain an erection. Another option besides the pills and the vacuum device is injection therapy. These therapies are meant to put medication directly into the penis. That helps the penis fill, and once it fills with blood, what happens is you're able to maintain an erection, and that can last for an hour, 2 hours, and that's long enough to engage in sexual activity. Now, when we talk about long term, we're talking about 3, 6, 9 months, we continue these kinds of therapies, again, to try to help regain normal sexual functions. For those guys that have not regained sexual function, then we begin to talk about other options. Currently, we are looking into other options such as Shockwave Therapy. Shockwave Therapy is something that you might have heard about. It's something that's new, and it's being touted as a cure, but in fact, it's not a cure. It's meant to be an adjunct, and in fact, the AUA and the Sexual Medicine Society has deemed it as experimental until it's proven otherwise. And so we are working on that, and it does work well for some patients, but not all patients. So it is an option that we continue to look towards and try to exercise. The other option for long term, we're talking about patients who have failed the other therapies, is considering a penile prosthesis. Now think of a penile prosthesis like a breast implant. Breast implant is under the skin, you don't see it, it's cosmetic. It should appear as you don't have anything in there at all. And the difference is that you no longer get a spontaneous erection. You require to stimulate the pump in order to get an erection. That means you pump up the fluid that goes into the cylinders in the penis, and that will give you an erection. Think of simulating blood flow into the penis, but instead of flowing spontaneously, it actually flows from fluid that goes from a reservoir into the penis. And that helps them maintain an erection for as long as they want and then bring it back down. Now, one of the misconceptions about penile prosthesis is that it can change size. That's not true. Unlike breast implants you can make them any size you want. Penile prosthesis you can't. There's a limited size. That size is determined by the size of your penis. It's not something that is meant to be cosmetic as breast implant. It is meant to be functional. But the surgery should be carried out to look as if it was a cosmetic procedure, because you don't want any unsightly scars or any elements of the prosthesis showing through the skin. Now, when we talk about urinary incontinence, we'll switch back. One of the things that we know initially after the catheter comes out, almost all the patients, you could talk about maybe 60 to 80% of the patients will have some level of incontinence immediately after the catheter comes out. This is short-lived. Like I said before, within 3 months, that usually corrects itself, and we only get about anywhere from 3 to 5, maybe 10% of patients, depending on whose hands you're working with, that have long-term urinary incontinence. And that does not correct. Those are the patients that we address. But for all of our patients, we require or we recommend doing pelvic rehab therapy. So we have a specialist that works with us who helps them do exercises for the pelvis, for the muscle, to strengthen those muscles in order to maximize their recovery period. And usually we say we're very aggressive about doing this over a long period of time, or until incontinence is when continence is restored. Now, for those patients that failed those therapies and continue to have some level of incontinence, there are treatment options. One of them is naturally doing minimally invasive procedures such as injection therapy around the urethra to close up the opening a little bit. The other one is doing what's called a sling. This is a support structure that's placed underneath the urethra to elevate the bladder neck and the urethra in order to close it off and increase tension. And the third one is called an artificial urinary sphincter. Now, the artificial urinary sphincter is meant for patients who have severe incontinence where they continue to use pads or diapers despite all kinds of therapies that we may try. So the message that I want to carry out to you today is, number one, yes, prostate cancer is very common. Yes, it's treated surgically, but people are afraid of all the post-op complications. These post-op complications are very easy to take care of. Think about what I'd like to tell my patients is we eliminate the disease, get rid of the problem. we can rebuild you. Think of the $6 million man. You guys are too young for that. But the $6 million man, the term was, we can rebuild them. We have the technology. And it's true. We have everything at our disposal to make you whole again and to make you feel like that is part of your past and not part of your future. So feel free to give me a call. And it was a pleasure being with you today.